colleagues, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. On behalf of the Islamic Cooperation Youth Forum, it is with great pleasure that we welcome you all to the first panel discussion of the Virtual Youth Council of Foreign Ministers of the OIC under the Islamic Committee for Health, COVID-19 Challenges and Prospects on this day, the 23rd November 2020. Before we kick off the panel discussion, let me introduce myself. I'm indeed your humble moderator, Farid Zakir, from the Federal Republic of Nigeria, professional officer at the Department of Foreign Affairs at ICYF. Ladies and gentlemen, allow me to mention that the Youth CFM is a unique simulation version of the Council of Foreign Ministers of OIC, having no analogies in the world. Our conference will take place as a virtual site event in the margins of the 47th official session of Council of Foreign Ministers of the Organization of Islamic Cooperation, due to be held on 27-28 November 2020 in Niamey, Niger. The world is struggling with the global pandemic, COVID-19, and this has caused horrible health and socio-economic challenges in the OIC region as well as on the global landscape. Now more than ever, we need to create and strengthen structures that are radical and boast collaborative effort and unity. We need our youthful population to call it the road to recovery for the OIC region and beyond. This virtual summit is an important opportunity to raise awareness on youth-related issues and promote youth creative as a critical factor for national development, as well as to boost exchange of the best practices for implementing more efficient youth policies in the OIC member states. Ladies and gentlemen, I cannot go on without thanking our respected speaker, Professor Ida Jiyad Al-Qutb, board member of National Healthcare Accreditation Council in Amman, the Hashemite Kingdom of Jordan. Ms. Raida is a professor of public health and a physician by training with a wealth of experience in social development, health education and population program development, implementation management, and policy and advocacy. Throughout over 33 years of work, she developed a strong consolidated experience. This experience has been enriched by academic involvement, both graduate and postgraduate levels. The conduct of scientific research assuming public, United Nations organizations, UNICEF, UNFPA, and World Health Organization, and civil society top-level management and leadership posts. Professor Aida served as the Public Health and Children Advisor to Her Majesty Queen Rania Al Abdullah. She also served as the president as well as a board member in several national, regional, and international bodies, including public, private, and non-governmental organizations. She also held a top-level management position in academia as the first woman dean of the School of Medicine at the University of Jordan since the establishment of medical schools in the country back in 1970. Professor Ida also worked as the World Health Organization Regional Reproductive Health and Family Planning Advisor seconded to the UNFPA Regional Technical Support Team. She was a former president and member of the Islamic Development Bank Women Advisory Panel, which is composed of 13 members representing 58 countries worldwide. Professor Aida was a founding member and elected Vice Chair of the Middle East and North Africa Regional Health Policy Forum established in 2004, and she is also a member of the Jordan House of Senate. Ladies and gentlemen, it should be noted that our speaker will be discussing for 35 minutes and Q&A session is 25 minutes. Also, if you want to ask a question, just raise your hands and I will give you the floor. Distinguished participants, illustrious audience, without further delay, I would like to give the virtual floor to Professor Aida. Professor, the floor is yours. Thank you.
Distinguished youth generation, I mean, you are the future, and I'm so happy to be among you. You are all like my kids. I have a son and a daughter, and I just consider that I'm sitting with my son and daughter. You are all my kids, and I'm so happy to be sitting here talking to you and listening to your fruitful ideas and thoughts. I love to work with people like you, and I teach at the university. I myself don't like teaching, but I like the opportunity of being involved with young chaps just as yourselves. So it is a pleasure for me to join today. So I'll be talking about the challenges and prospects of COVID-19. And anyone who wants to talk about COVID-19 should start first by talking about what is it that we are talking about. COVID-19 is a disease that is caused by a virus that is called coronavirus. And we have to understand the epidemiology of this virus in order to know what are the challenges and what are the prospects that we are talking about. Of course, all of you are witnessing and have witnessed maybe the infection of one or more of your friends, of your family members, of your health workers in your countries, affected by this disease. So this disease is a highly contagious disease that is caused by a virus that is very virulent. Virulent means that it is very active and it moves from one person to the other so quickly. The disease is also considered deadly, but it is not as deadly as other viruses. Like the influenza virus used to kill more people. But what characterizes this virus is that it moves so quickly between people. And because it moves so quickly, it affects many people and it can kill. So the speed of infection is very important. And this is why it is affecting now more than 55 million people around the world. And it is killing over 1.5 million people around all over the world. I'm sure each one of us can talk about his own country, but we have always, when we talk about any disease, to understand how does it spread. So the most important thing that it is a virus. It's like any upper respiratory system virus. It can affect all of us, but this virus is characterized by the ability to affect the respiratory system as well as other systems of the body. And it affects more the old people and the people who have other diseases such as diabetes, heart disease, chronic respiratory infections, people who have cancer. So these people are more prone to becoming severely ill, and also they are more prone to die because of the severity of the disease. But also it is characterized by affecting so many people without showing any symptoms. So it can affect you as young adults, but it doesn't show any symptom. And this is the dangerous thing about it, because you might be having the virus, and you are spreading it to other people, like your dad, if he is an older person, or if he is a person that has other diseases, you can infect them without even knowing that you have the virus and you are spreading it around. And this is what makes it very dangerous, because more than 60% of the people carry it and they don't show any symptom. But at the same time, when they carry it, they become infectious. It's true that when people are asymptomatic, that is, they do not have symptoms, maybe they will spread it in a less severe form. But also, the more close you are to the person to whom you are shedding the virus, and the more serious the status or the condition, the medical condition of the person with whom you are sitting or with whom you are talking, you can spread the disease very quickly. It is characterized also because it is a disease that affects the upper respiratory or the respiratory system, let's say. You can spread it through the droplet infection, which means that when you talk or you cough or you sneeze, you spread the droplets of this virus. And because it is highly contagious, if you sit very close to a person and if you are not covering your face, your nose and mouth with anything such as a mask, it means you are spreading the infection. So these characteristics of the virus, plus the epidemiology of it, that is, where does it spread, to whom does it affect, and who is most likely to get the severe disease and to die of it is important. And we call these epidemiology, which means that these are the characteristics of the disease. It's spread over time, it's spread to people, among people, and it's spread among different locations. Of course, everybody is prone to getting the disease. Everybody can get it. Nobody is immune to getting the disease, the virus. And when the virus is severe, about 5 to 6% of these people get it in severe form and they enter the hospital. They need to be hospitalized. And about 1 to 2% of these people need to be entered or admitted to the ICU, the critical care units, and half of those who go into the critical care units may be put on artificial ventilation. That is, they need oxygen through an equipment, and half of those might die. So these are the characteristics of this disease. So what are the challenges? The challenges that this disease carries is basically, now we can talk about them at the individual level, and we can talk about them at the community and at the state level. And why it's important for us to know the challenges? It's important for us to know the challenges because we need to address them and turn them from threats and weaknesses into opportunities and things that actions. Okay, so what are the challenges? Now, this disease, because it is contagious, and because it affects people, and as I said, 5 to 6% enter the hospital, they affect the healthcare workers. So the frontliners, such as doctors, such as nurses, people who deal with the ventilators, technicians that work in the CT scan, for instance, technicians who work in the ICU units, all these people are more prone to getting the infection, and a lot of them die because of getting the severe type of the infection. So this is one challenge, that it is affecting the healthcare workers. So these are the frontliners that are trying their best to serve us, to help us, to protect us from dying and from getting the disease in severe form, but they are the ones who are affected now most, and they die because of it. So this is one major challenge. The other challenge is that because of the speed of spread of the disease, it is the health services in different countries are not able to catch up with the amount of people who are infected. As I said, because the disease most affects a large amount of people without any symptoms, and these are young adults such as yourselves. They move around carrying the disease, spreading it around without knowing. So if they are not using the proper precautions to prevent others from getting the disease, like wearing the mask and staying away from these people and washing their hands oftentimes with soap and wearing gloves wherever it's appropriate, they will spread it to other people. So with this, there are so many cases that are affected, and this means that these affected cases, they need to be admitted to the hospitals, and this overburdens the health services. So the health services now, not only that they are not able to deal with the COVID cases, we call it COVID-19, but also they are not able to avail themselves to the regular diseases that used to need the hospitals and to need the health services, to need the community health centers, to need the clinics of the doctors. So these people are now asked to wait and not get any of their essential health services because the health systems want these services to be made available for the COVID cases because they are afraid that these people will die or these people will stay at home with their severe illnesses and they might affect other people who are at higher risk. So this is another challenge. The other challenge is that the health services are not able in different countries to cope with the amount of cases that are being getting the disease. Another challenge is that people, because of the nature of the disease, have to stay at their own places, at their homes, at their own facilities. And thus, the health services are not able to open up for all people at the same time. So they need to use other ways of getting trained and of getting available and accessible the rest of the services. So they need to use other modes of communication, which is basically the online communications, such as the ones we are using now. With this online communication, we need to be trained on it. We need to know how to get training using the online communication. We need to have fiber optic communication channels available in all countries, in all places, reaching all far areas. And this is usually a challenge to countries, especially countries who are not yet wealthy enough to have all these installed. And in the remote areas and in the rural areas, there are so many communities that cannot be accessed using this mode. And this means that these people either will not be able to get health through telecommunication, or they will not get the health services as they used to have to do, especially the essential services such as for chronic diseases, medications for chronic diseases, investigation of chronic diseases, being able to get their surgeries if they need to. So now it is basically done, all the elective surgeries or the elective care is being postponed, and only the emergency care is being cared for. Now, the other major dilemma is the financing. All these services carry with it cost, and the cost on countries is being huge and high because they want to avail more ventilators, more ICU units, more doctors, more nurses, more technicians, more PCR testing kits. They need more epidemiology investigation teams going to homes, investigating for cases who are contacts to the original case. So these are all very costly services, and they need financing. And the financing, especially in poor countries, is not that much. And this means that the original finance that used to go to health is now being directed and channeled to deal with COVID investigation, COVID identification of cases, COVID treatment of cases, and making sure that these people are not dying because of the disease. One more challenge of this is the disease itself. It is not only an upper respiratory disease, but the disease itself can also, the virus can affect other systems of the body. And these systems of the body, we are just discovering what are those systems. Sometimes we discover, okay, at occasions they said it only affects the respiratory system, and then it was discovered that it affects also the renal system, and now we are finding out that it affects the neurological system, and it affects the memory, it makes confusion, it affects the mental health. So the effect is huge, and we are still studying what could be the long-term effect of the disease on the human being, not only on the physical aspect, but also on the psychological aspect. One more thing that goes along the challenges, I'm only now talking about the health system challenges, is that challenge that is related to availability of medication and availability of supplies. So when we say we want to use the masks and we want to distribute the antiseptics such as alcohol, hygiene, we want to make sure that there are oxygen pumps available, that is, there are oxygen available in the hospital, etc. This means that somebody has to produce this, and not all countries neither have the capacity to produce and ability to produce, nor with the closures of borders between countries are able to get those to reach their own countries, and also they need the money to pay for those. So the production of supplies and the availability and access to supplies and availability of medications and supplements and access to them is also a major challenge to countries, and especially countries who are in the poor, underdeveloped, low-income countries all around the Islamic communities and Islamic countries. Now, one more thing is about communities. To what extent are our communities aware and able to deal with this disease, to prevent it from spreading and to prevent people from getting the infection and dying from the infection? This is a major challenge, and people and communities are one major pillar of the health system. Now, people sometimes they they read and they hear about, okay, this is a virus that's been created by by a human being. It is not a natural virus, so this is a challenge. Some people say, okay, I don't want to believe in it, so they don't use any of the PPEs. PPEs is the personal protection equipment. So they say, okay, so this is a conspiracy. It is coming from us, from the West, and we don't want to deal with it. And this is wrong. Even if it is a product of a conspiracy, it is killing people, it is causing disease, and we have to protect ourselves, protect our household members, protect our neighbors, our family members, our grandmothers, our grandparents, our parents themselves, our older sisters, etc. So there is this is also a challenge, that are the misconceptions and the myths that are going around in the communities, and to what extent people and citizens are aware of the disease, are able to protect themselves and to protect others from the disease. So these are major challenges if we are talking only about the health. Now, other challenges deal with the economic component that this is causing. It is not only causing health consequences, because when a person is not healthy and when he is diseased, he cannot go to work. So this means that unemployment is going to be higher. Also, countries have to institute measures like just as lockdowns, smart lockdowns, and what have you. I'm sure most of the countries have experienced this, and most of you have experienced this in your own countries. So what does that mean? It means that jobs are not available. Those who work are going to have reduced salaries because they are working from far and they are not going to their work as they used to. A lot of companies have closed down, and all of this caused what? Economic recession in different countries. Economic recession causes people, especially the young ones such as yourself, to be frustrated because they want to work, they want job opportunities, they want to be productive, and they cannot stay just at home or stand still. So they need to cut across with their life. And also, it causes mental consequences. Mental consequences, these are important because when you sit at home, you are thinking, what am I going to do? How can I spend the whole day? What shall I do? I am not working. How can I contribute to the community? How can I contribute to developing my own new household? If I want to get married, how am I going to earn money? If I want to help my family, from where am I going to get the money? So this is another mental health issue that's affecting a lot of young people because of the consequences of this virus. One more thing is that it relates to education. And education is now becoming from far. It is virtual and online education in most of the countries. And this carries with it its own challenges. And I'm sure all of you are experiencing the challenges because online education has not been practiced before. Even in the countries in the West where it has been practiced, it did not prove whether the impact is positive or not. Universities, higher education, wherever a diploma, whatever you are talking about, there are some kinds of topics that do not, they are not, it's not enough for them to be online, such as medical schools, any profession that needs online or hands-on training and experience. So with those, there are challenges. How can we ensure that the education is okay, that it is done properly, that it is done successfully and comprehensively, and that we are getting the outcome of education the way it used to become. And we cannot compare it because we don't have a baseline of education or comparative education at different times. We are just faced with this educational challenge. Mr. Farid, can you just alarm me when I am close to the time limit, please?
Excuse me, please. Could you repeat?
Can you alarm me when I am close to the end?
Of course, sure.
How much time do I have left?
You have like 10 minutes.
10 minutes, okay.
Yeah. Thank you.
Now, so also there are consequences that are social. and social, which also relates to how do we interact with people. I mean, any one of you used to go to visit his friends, visit his families, go to cafes, interact with people outside home, go to gardens, all these. With the lockdowns and with this disease, we are now starting a new style of life. Even us, the older people, are not happy with this style of life. So what about you? You are full of energy and you are full of all these new ideas. You want to innovate. You want to be on the street. You want to be on the run. So it creates another social dilemma. It is lack of interaction. It is isolation. Isolation for older people. Isolation for family members, being far from each other. We greet each other from far. We don't use the warmth that we used to do before. We don't hug each other. We don't kiss each other. We don't express the feelings to each other. These have all social and mental consequences, and the isolation creates a lot of psychological distress. And this is distress, I'm sure, on the long run, we are going to study it and to find out how did it affect our social interaction and the social isolation. How did it affect our health, both from the physical health as well as from the mental health. Now, besides all of that, we have to use these computers and to do all online training and online and Zoom meetings and conferences and etc. And this means we have to sit down and we have to talk and we have to look. For instance, now I'm not able to interact with you well, because if I look at you, I will be looking down. And if I look up, I have to face the camera. So I'm looking at this point there. So it's like I'm talking to myself. There is no interaction. I cannot feel this interaction. And this really puts a lot of stress on us. It puts a lot of stress on our back, on our neck, on our eyes, on our body, and the way, and the posture, and everything. So all of these are challenges, both health, occupational, mental, physical, psychological, social, economical, whatever. There is one more challenge that is also facing states, and not only people and individuals and communities. It is facing states because when they close borders, first, they don't have this ability of the globalization that we used to have before. Is now being cut. It's only through the internet. But the physical globalization has been put to an end now, or it is very, very minimal. We do not travel. We don't get exposed to each other. We cannot, sometimes we cannot get the raw material to produce what we used to produce. Even the food security is not as it used to be in different countries. We used to, for instance, in Jordan, we used to export our food. We used to export our vegetables. Now it is being put on hold. People we used to import, now this is being put on hold because there's no money to exchange these products, and also we don't produce because of the lockdown, because of the people are not able to move around as they used to. Everything is being put standstill. So the regulations between countries, people, also states, cannot just keep people traveling from one place to the other without these quarantine regulations. Before, at least maybe a few months before now, nobody was able to travel. We were like put in a bubble, just living with each other. We were not able to travel, or people come to our countries, and I'm sure the same is happening with you all. We're not able to go to Mecca, to go to pilgrims, to go to Umrah. And all of this puts a lot of stress both on countries, and also because we are talking about foreign ministers. This is a challenge to countries. How can they interact with each other? How can they put regulations among their borders so that the infection is not transmitted from one country to the other, and at the same time their economic states situation is improved, and their relationship with different countries is improved, and their diplomacy takes place as it used to do. So all of these are challenges. Now I'm going to talk about in a quick manner to talk about the prospects. So the prospects now, let's talk about information, the information and technology. It is producing another new prospects for anything that is online to develop and to develop quickly and well, so and to be improved so that we can benefit from this technology. With all the side effects that I've talked about, I'm sure there will be people with like yourselves who are able to create and to innovate ways of doing things online, but doing it properly without harming our mental health, our psychological being, our physical well-being. Also, it gives us opportunity for self-development and self-employment, because now work and jobs are not available to all of us as it used to be, and work from home is the character now, and the salary is being cut into half maybe or to 30%. So we have a lot of time to create, be innovative. How can I work from home? What kind of job can I develop? How can I move around with it? Distribute it worldwide, do it on a regional basis or international basis. What are the needs of the nations all over the world? So you can be innovative, and you are the best people to think about what are the new creativity and creations that the world need at this stage, and how can I contribute to that, so that if I am not employed and I'm at home, I can develop a new opportunity and I can do it from home. One more thing is that it relates to the production of medical supplies. So this is also a prospect. How can I produce something that can contribute to medicines, supplies that can protect us from the disease, and vaccines? How can these vaccines be productive, and how can they reach everyone? The vaccines are now in there. This is another prospect for the COVID-19, is that medications, although we are not able to see medications that are tailored to this virus, but the vaccines are on their way. So this is a good prospect for COVID-19. But this prospect needs people to work on making sure that this vaccine reaches everywhere and everyone who is in need. Of course, everyone is in need, but priority should be given to older people, to people who have risk conditions, and to the frontliners. So how can you contribute yourselves as young generation? How can you help in distributing this vaccine to reach everyone so that it is equitably distributed? Now, as you have seen maybe yesterday and before yesterday, there was the G20 summit where all countries met, and they were trying to see how this vaccine can be developed and distributed to all the world. So especially to the poor countries, so it is being made available and accessible. This is good. But what is your role in that? And what would be the role of the prime ministers of making this through their diplomacy available to the poor and to the needy countries in our Islamic Ummah? And the food security is another prospect that is important. You have to think about how can we, together as countries, ensure that food is available to all countries because of the lockdowns because of the economic recession in different countries now. Some countries will not be able to ensure the availability and access to food supply in their own countries. How can we develop a mechanism to ensure that food is secured for different countries all over the Islamic Ummah? I think I'm going to stop at this. I think I've covered all. Yes, one of the prospects of COVID, which I liked very much, and I think you should also thank. We would thank the virus for initiating this. I don't know if we have to thank, but I personally think this is a positive thing, that it created more family-oriented life. So before, I never used to see my kids around me. They are now, my son is 33 and my daughter is 28, and they are on their own, living their own lives. But with the COVID and with the lockdowns, we started to see each other more. Sometimes with the lockdowns, we sit together, we interact, we talk, we discuss. This thing we used to miss, and I think it's an opportunity. It is a good opportunity to recreate the family life, to recreate some of the things that we have missed, talking to our neighbors, walking around our neighborhood, feeling and touching and seeing the things that God has given us, the beautiful nature that is around us. We used to miss all of that because our life was very hectic. We lived just to work. Now we have to think about, okay, we live to enjoy our things, the things that God has provided us with, and then we can work. Doesn't mean that either this or that. We have to join them together. I think this is something that I found is a blessing. When I was locked down, and my husband and my son were in the United States, they were locked down there because the borders were closed. I used to take my daughter and we used to walk because they said lockdown, but you can walk only, you can get your own things from small supermarkets and you can go by walking. I enjoyed that because I was talking to my daughter, I was talking to the neighbors around me, I was able to walk, to see the nature, to do some physical activities, and all of those are contributors to reducing non-communicable diseases. Non-communicable diseases that are due basically to obesity because of lack of physical activity, because of eating bad food, and with the lockdown, we had to eat natural food that we have raised in our garden. We had to go and see the nature, so we used to walk, and this is something that is very healthy. And I found that these are very, I would look at them as positive aspects of COVID. With all the negative aspects of COVID, this is a positive aspect that we have to tap on. I thank you very much for listening, and I look forward to listening to your points, to your interventions, to your ideas about what we have discussed, presented. Thank you.
Thank you very much, Professor, for the insightful discussion. Ladies and gentlemen, dear participants, we have now come to the part of our Q&A session. Please just raise your hands and I will call your name to unmute your microphone and ask your questions. Thank you very much. I would like to give the floor to Huda Numan from Pakistan. Please unmute your microphone and ask your question.
Assalamu alaikum, everyone. Thank you, Professor, for that. I have just one question. That you said that people don't believe in the coronavirus. They think that it's a conspiracy and all that. So what can be the ways that we kind of spread awareness regarding it? Because the government awareness campaigns are not effective for them because they don't believe in the government. They don't trust their governments. So what can be the ways to spread awareness in those areas and those people?
Yeah, let me answer question by question. I think this is more helpful. This is also my worry. And this is the thing that I keep thinking about day and night. Because if people are not convinced, it is very hard to change, even if they know. They have bad attitudes and negative attitudes, their behavior will be, they will not behave and they will not use the proper practice. And this is known from studies that if to have the knowledge is not enough, and to have positive attitude is not enough. For instance, if people, and most of the young people, if they smoke, they would know that smoking is not good and it's harmful, and they will have negative attitudes towards smoking, but they don't translate this into action because they have no intentions. So it's important to have the intention, and the intention comes when you believe in something, when you believe in it, and this is called the health belief model. So we need to work on the beliefs of people and change their beliefs. And I think this could be done through just seeing for themselves that their loved ones are dying from the disease. They will develop this. So maybe in countries, the mass communication channels, such as the formal TV network or the formal radio network or the formal social media networks, they need to use these eyewitness cases to present to them what is going around. Cases that are real, cases that have died. These are real cases. They are not fake cases. Even if it is a conspiracy, even if it was, I mean, I myself listened to so many videos. Most of them say that this is not a natural virus. It is a manufactured virus, let's say. It is a produced virus. Okay, but it is there. It is a virus that is causing a disease. So it doesn't mean that we just keep it and leave it and let it work as it's now doing. It is killing people. So this is one of the things, is that we have to go down to the people's perception and ideas, and see how can we change their perception, find out the right interventions and the right ways. And there are different models in the world that have worked out. Even the smoking, you can see in the countries around the world. I mean, in the UK, when they put fine on the smoking, and when they put law to ban smoking, smoking is not as the prevalence is not as it used to be. So now some of the countries, such as the United Arab Emirates, are putting fine on those who do not wear the mask and who do not use the social distancing as one of the PPEs, the personal protection measures. Now, this is important. I don't like to use law and to punish people. But if people are not responding, and if the freedom of one affects the freedom of others, so the country has to also go to other ways, such as punishment and using fines, such as financial fines.
Thank you, Professor. I would like to give the floor to Muhammad Al-Buhadi from Iraq.
Hi, my name is Muhammad Al-Buhadi. I'm from Iraq, and I really like how really realistic you're talking about the whole pandemic thing, and how it really affected us with the whole challenges that it did. I just wanted to highlight some really exact points we talked about. So obviously we talked about the economic crisis that the pandemic did, but we're all talking about the negative side of it. Not a lot of people would talk about the good side of it, which is a lot of supply chains are not changing, are developing in the same time. It created an impact and a motivation, a positive impact, let's say, for supporting the national products. Like, for example, Carrefour or Amazon would survive the pandemic, but for example, not some simple person's supermarket would survive. So people would thinking about obviously supporting the national product more, and really support the local manufacturers to do such stuff. So I think that's something worth been saying. So I'm saying it. And I do have we talked about what about the vaccine and the food problems. So I did have some ideas, but those ideas should really have some a responsible political authority to do. So basically, we're having the constitutions, we're having the whole let's say the places where to start, but those are not really effective. So basically, there is a lot of negative sides by how the World Health Organization handled the pandemic. So we've talked about the poor countries that cannot really afford vaccines. So why not there is a political authority that can use its powers to really control the vaccines prices and logistics to those countries. So that's an important thing, as I'm thinking. The other thing we talked about is the food control. So we're having the health and the vaccine thing. The WHO can get it done, because that's its responsibility, and we have FAO, which is the food world organization. So it can do the food control too. So we're having the places, the norms, let's say, to really just solve those problems, but it's not politically activated. Everyone is just going around their own. They're just thinking about themselves. Even if we're not talking about the whole world, even if we're talking about Europe, I'm half Italian, and I know what Europe is all about. It's all about this the European Unionist, let's say, a perspective, and it vanished with COVID. So if we're talking about the world, it's a whole another level that it's really hard to accomplish. So so that's a side that I wanted to talk about, and I really appreciated you talking like realistically about it, because most of the people, a lot of scientists, let's say, even they're really they're positively unrealistic, let's say. So I really appreciate the opinion that you got, and thanks for your talk.
Okay, thank you for your notes. And I think
if you got, thank you for your opinion. It would be appreciated. I've talked a lot. I'm sorry.
Sorry?
Yeah.
I'm sorry?
I've talked a lot. I've mentioned a lot of points. So like you can just give a general like statement to those points if you can. Yeah.
I don't know who is talking, but anyway, let me just respond. I mean, most of what you said are statements. There are no questions for me. But I think I do agree with you that most of the things that we have to think about are the positive things. There are a lot of negatives, and everybody is talking about the negatives, but we have to turn those negatives into opportunities. And for our Islamic world, we have to act, and act quickly. We should not wait, neither for the European Union nor for the pardon me? Hello?
Yeah, you can proceed, Professor.
Yes. Neither the World Bank, nor the European Union, nor the World Health Organization, we should not be waiting for any of those. The OIC, which is the Organization of Islamic Countries, we are a big ummah, we are big countries, we are very rich countries, rich not only in terms of money, we are rich with our people, we are rich with our minds, we are rich with our faith that tells us to cooperate and to work together. And we can work together, we can think together, we can produce food supply that can be enough for all this Islamic Ummah. We can produce vaccine that can reach everybody and it can be equitably distributed. Our rich countries can help the poor countries. Our poor countries might have good brains, but they don't have money, so we have to use their brains to develop ideas, to be creative, to be innovative, to produce and to sell and to bring back the result of this money to help people and to enrich them and to empower them and to make them live healthy and prosperous lives. So I am so confident that we can do it if you as young generation come out with these conferences and with other conferences with the solidarity that we need, with the ideas that you can do it, because you can do it. You are the future, and you are the ones who should lead our nation, our Islamic nation, towards the future. You can think in different ways, you can use different and new technologies, and you are very innovative, and you can do it if you have the will, and I'm sure you have the will.
Thank you very much, Professor. I would like to give the floor to Tamri Doha. Please unmute your microphone.
Good morning. So honored to be here with you, madam. It's Doha from Morocco. I think there is a main problem concerning the virus, which answers the very first question that said how to deal with people's beliefs and stuff, like people not believing in the virus itself. I think one of the challenges that we're facing in the modern era is in the age of the internet, global communication, social media, it has also allowed us for an age of misinformation where there are a lot of inaccurate information and false information that is spread for people who are not experts, even experts in the field. So I think from a very Islamic perspective, if we learn about the sciences of the transmissions of the Prophet Muhammad ﷺ sayings and actions, you learn that there is a chain of narrators. The chain of narrators has to be reliable and connected. So there is no trace of the chain of narrators, obviously, on social media, so you cannot determine from where it is coming from. And I think since we're living in an age where not only actually consumers of information, we're also producers of information. And we're also living under a necropolitical system and structures that we're not only taught how to live, but also how to die. We're controlled. A lot of people are talking online about the vaccine and how to deal with all of this confusion between people who are experts in the field and between people who are just talking for the sake of talking, and how to deal with confusion online and mass amounts of information concerning the vaccine. Thank you so much.
Yeah.
You're welcome. Thank you, Tamri Doha. I would like to give the floor to Ali from Nigeria. Please unmute your microphone and ask your question.
Okay, thank you so much. Thank you to the speaker. I just want to mention a point regarding the technology, the good perspective of technology. It is true that technology has evolved and we've been able to adapt to it. But there is one point where, since we're talking about Islamic countries, and we know when we talk about Islamic countries, we're talking about North African countries, also African countries. We're talking about the rural areas. When the Huda was talking, she was talking about the awareness. The information are coming from the internet. The rural areas don't have access to this internet. I think that's a problem itself. And also we talk about another aspect, which is the education. At first, rural areas have problem with education. Now it's becoming a bigger problem since we're talking about no internet access. So from there, I think it's another important aspect that we need to tackle. Also the rural areas, they are being like marginalized in this aspects of COVID-19 and the prospects and the problems. And that's it. Thank you.
Yeah.
Yeah.
May I respond to these 2 points?
Yeah, sure, of course.
Yes. Now, both of these are related to ways of reaching people. One of them is through the social media, as was said by our friend from the Malaysia, I think, from I guess, and the other point came from Nigeria. So one is communication direct with people, and the other one is related to communication for education. And I do agree with both of them. And I myself, although I am a university professor, but I can say that there are so many things that I am not used to using the digital information system. So I was trained in the States, and I got my PhD from Johns Hopkins, which is, #1 in public health in the world. But that was 35 years ago, and we never used the new technologies. So I know that all of you know better than me how to use the technology, the smartphones and the iPhones and the WhatsApp and all these social media things. So I feel myself, when I was asked to teach my students using online teaching, I had a phobia, and this phobia even became more because at my home, when my husband was quarantined in the States, there was nobody to help me if there is a disconnection in the internet. So with me having an internet connection and being educated, I had this phobia, and I was afraid, how am I going to teach my students if the line becomes disconnected? What shall I do? How can I do it? How can I, if the Zoom is only for 45 minutes, how can I do it again? So what about those people who live in rural areas, who live maybe in African areas that do not have, they do not have access to internet? Even in my own country, in Jordan, we have very good internet connections. I mean, it reaches everywhere, almost everywhere, but there are areas who have no internet. The older people, how can they link? How would they know how to prevent themselves from the disease if this all depends on the internet and on social media? They are not able. I mean, they have diseases like, for instance, Parkinson, which is moving the hands. I mean, the hands becomes, there are tremors in the hands. They cannot even hold their iPhone. They cannot know how to deal with the iPhone. So all these are challenges that we have to face. It's not only using online and using internet and using technology. There are so many challenges that come with that. And the countries and the states need to address those. We have to use, to do gradual change, not abrupt change. We have to take care of all the segments of the population and all the geographic areas when we talk about changing our way of life, changing the communication channel. We have to make sure that, as was said before, that there is an authority that produces the right information, and that right information goes to the people equally. So it's not only those who can access the technology properly can get to the right information, and those who cannot, they can get all the rubbish information which does not help them anyway. So all these are challenges that we have to, I mean, it is a prospect that we have to tap on, but at the same time we have to be very careful and attentive to the challenges that come with this prospect, and we have to deal with those.
Thank you very much, Professor. I would like to give the floor to Aisha Boyne from Guyana.
Assalamu alaikum wa rahmatullahi wa barakatuh. This is a former frame for the vast perspectives that you have enhanced on. Now, I would like to bring to light the side effects of the persons who are afflicted with the COVID-19 virus, not only them surviving the virus, but to learn in the long term they are still being afflicted by the devastating effects of it. And also you mentioned that the healthcare system in various countries being equipped to handle or being well financed to handle such cases, and more so the long-term effects. How will the funding be to handle the cases of the COVID, the surviving victims, the long-term effects, and also the normal afflictions of the healthcare system that they have to deal with year-round? Now, funding may be received from various other countries, organizations, and stuff. However, for the small country, which is mine, it's been a major challenge in the, getting financial support, combating the virus, and also providing needs of the countries. Now, my question will be, as it relates to combating the pandemic, the virus, and the side effects that are presenting itself, and we don't even fully know what are all the side effects, right? How would you advise the, would you say, Western countries or the hierarchy to look into smaller countries and how they can help them along the way as it relates to combating the virus? Thank you.
Okay, thank you for the question, and I think it is a very legitimate concern. It's not only your country, because it's small, that did not get good financial support. I think all countries, most of the funding that used to come from donors has stopped or has been channeled to other things. And this has created a lot of economic dilemmas to different countries. One of them is my country, Jordan. I myself is among the people who think we should not depend on donor agencies. Each country has good resources. My country has no resources. No, we don't have like petrol. We don't have good agriculture. We don't have a lot of resources. But our best resource is the human being. So we have the brains. With the brains, we can do a lot. Each of the countries, the Islamic countries, we have resources. The resources could be people. It could be they have good soil. It could have, some countries have good weather and climate. Some countries have gas. Some countries have the sun. Some countries have the sea. So, but we are not utilizing those, and we are just putting ourselves under the impression that we cannot live without the donor agencies' support. And this, in my opinion, has created a lot of dependence on our part on these donor agencies. It's always good for us to initiate some cooperation between countries, the rich and the poor, the south and the north, etc., the north and the south. But as all of us are seeing, when there is a dilemma, when there is a pandemic, when there is a catastrophe, each country deals with its own people. It only worries about its own people and maybe the union with which they are united, such as the European Union or what have you. So my personal advice is for us as Islamic countries is to find out our commonality, common resources, and tap on those and find what are the strengths that we have. And I'm sure we have a lot of strengths and we have to tap into those. Within our own countries, in my own country, I am sure we have a lot of resources. For instance, few years from now, we never thought that we are a sunny country and the sun is there for around 18 hours per day. So now we knew that, and we have developed many plants that are using the sun to produce electricity. Our main resource that used to take a lot of our money is to pay for the electricity, and we never thought about it. Only we thought about it when we were indebted because of a lot of money going to electricity, and then we started thinking about what other resources do we have. We found out that we have sun that is there in our country around the year, and in each day it can give us supply for 18 hours, and then we would store this energy and use it when it is cold or when there is no sun. So it's like that. I think, and I am very confident that we in each country, there are good resources. The main resource that we have is our mind, our brain, our people. And God in the Quran said, Iqra. And this is the first word that he started with, Iqra. Iqra باسم ربك الذي خلق. So Iqra is the first word, and then باسم ربك الذي خلق خلق الإنسان من علق. So we have to read and we have to get ourselves educated, and then when we are educated, our brain can work and we can get all the resources and we can utilize those resources. And now for the international community, now the G20 summit that was held 2 days back in Saudi Arabia, it was basically to try to move the different countries to cooperate with each other and to try to ask people, these countries, to help the poor countries, especially with making the vaccine available and the medications, if there are any medications available. And also they touched on the climate change, which is very important because most of the climate change, maybe, I don't know, maybe after a few years we can discover that this virus has been moving around and spreading like that because of the climate change. Nobody also knows the answer to this question. It's yet to be answered and it's yet to be researched. But anyway, the countries are now being cooperating to make sure that they can help the poor countries. And I think that this also would apply to answering your question. But my own advice, my personal advice, and I hope that I can close my eyes and open it again to find out that our Islamic Ummah has united with the appeal to all the new generation that don't depend on donors, depend on your own food and your own supply, on the food security, on the drug security, on your own production, on your own countries like Syria, for instance, for years and years, it had lived without any introduction of any product from outside of Syria. Until now, maybe in the year 2010 and 11, it started this whole war, internal civil war and whatever. But before, I used to remember anything that we wanted to use in Jordan, we used to get from Syria. It was built and developed in Syria. how can that country develop its own resources without any use of any need for anybody outside its own country? So this is just for us to learn. We can do, we can work, we can produce. If we have the will, if there is a will, there is a way. And I think we have the will, but we should be able to find the will.
Thank you very much, Professor. I would like to give the floor to Zahidul from Bangladesh. Please unmute your microphone and ask your question. Thank you.
My question is, pandemic is nothing new in world history. People from all over the world have been dealing with pandemic for thousands of years. If you look at the, the golden age of Islam and like Andalusia, Muslim were at the forefront of the science, resources, even research, technology at their time. So does OIC have any message or activities for the Muslim countries to move from the theoretical knowledge to research-based scientific knowledge to advance in medicine and science?
Yeah, I think this is a request also, and this is also, it taps into what I was saying, that we have to work on our own. We should depend on ourselves. The research should start, and there are some verses from the Sunnah that talks about herbal medicine that was used when there was the plague years back at the I think at the time of Prophet Muhammad alayhi salam. So let's go back and examine those medications, herbal medicine. It's called al-qasd al-hindi, and there's something that talks about I think it's hadith that said that it was used, and I myself have used that. I have used that. My daughter got corona, and I took it every day because I believe that this, if it was used, it must have been helpful. So I used it. So it's time for us to research it, to see whether it is really effective and whether we can provide people with medications using that kind of herbal medicine. So as you said, we can be productive in production of medications or production of vaccines. We have to, and we have to start, and we have to be among those countries. Why would a country like the United States have two big companies like Pfizer and Moderna, and we are waiting for them to produce the vaccine, and everybody is killing themselves to pay for the vaccine upfront and to book it? When we in the Islamic countries, Islamic Ummahs, we are millions and billions of people, and we can produce. We can produce. We have good brains, and we can produce, and we can follow what others have followed before. We know the Razi, we know Zahrawi, we know Ibn Sina. All of these people were, I mean, the origins of medicine and surgery started there. So we have to build on those. I agree with you. And as I said, it's you, the young generation, who should take this forward and move with these excellent ideas.
Thank you very much, Professor. Distinguished participants, respected audience, finally our virtual youth CFM first panel discussion ends here. It has indeed been a lovely and interactive session. I cannot finish my remarks without reiterating my deep gratitude to our respected professor, audience, ICYF team, and of course you, the participants, for making this panel discussion a successful one. Dear participants, I would also like to conclude by wishing you the best in your upcoming panel sessions and diplomatic simulations. Thank you all for your attention, and may God bless you all. Assalamu alaikum wa rahmatullah.
Walaikum assalam. I would like also to thank very much the moderator for his excellent moderation and leadership of this session. And I want to thank the ICYF for inviting me, and I am so happy to be among all the distinguished group of young, lovely, our future.
Thank you very much, Professor. It is our pleasure.
Thank you.
Assalamu alaikum.
Assalamu alaikum.